Hey guys, it's Mary Catherine Nye. I am a board certified family nurse practitioner. In this video, we're talking food sensitivity testing. Food intolerance testing is a super important test and, in my opinion, is very underutilized in the healthcare space. In this video, I'm going to explain why it's so important to be tested and who could benefit the most from being tested. Before we get into it, here is a little bit about me. I am a board certified family nurse practitioner since 2008. I have helped thousands of patients get healthy from a functional standpoint, but we use food testing as a essentially pillar number one. We have to get our foods right. There's so many people out there with food confusion in the world of weight loss and weight loss resistance. I call infobesity, where there's so much coming at you. You got ketogenic, paleo, plant based, low carb, sugar free, dairy free, gluten free. What do I do? I've got food confusion. Getting food tested breaks through that confusion and provides clarity for you. It's objective. We use third party labs that do the analysis, and it's black and white. It's yes or no. It's like, get rid of this food for 3 months, get rid of this food for 6 months. Okay, this is my acceptable food list based on how my immune system is reacting to foods. So, tying into that, three main reasons why we test. You might want to grab a notebook, but three reasons why. Number one is that it takes the pressure off your gut, it takes the stress off your gut. People's guts are a mess, and we know that most disease and dysfunction starts in your gut. So, if you have constipation, diarrhea, gas, bloating, you eat something, oh my gosh, what the heck was it? Was it the dairy? Was it the eggs? Was it gluten? Was it something else? Again, confusion. So people's guts are a mess. And what this does, it takes the stress off of your gut. That's reason number one. Reason number two is that it takes the stress off the immune system. Ultimately, when we test, we're looking at your immune system to determine exactly how your immune system is responding and reacting. Guys, we have over 50 million Americans with an autoimmune condition. 50 million. That is 1 in 6 people autoimmune. Lupus, Mississippi, rheumatoid, celiac, Crohn's, Hashimoto's. There's roughly 140 labels of an autoimmune condition, and it's because our guts are a mess. We keep eating the wrong foods that our immune system does not like. Eventually, our immune system turns on itself, starts attacking our own tissues, might attack thyroid, that's called Hashimoto's. It might attack a nervous system, that's called MS. That's reason number two. We have to take the stress off of the immune system. Reason number three is that it reduces inflammation, but by eating the wrong foods, it drives inflammation. So there is a book called Your Hidden Food Allergies Are Making You Fat. However, this is all about sensitivities and intolerances and inflammation. This is over 300 pages of science and research and how food sensitivities spike inflammation in your body. We know that a lot of disease and dysfunction has an inflammatory root cause where inflammation is a driving factor. When you look at heart disease and cancer and diabetes and stroke and Alzheimer's, they all have an underlying inflammatory root cause. And we know that eating the wrong foods drives that inflammation. Guys, those are the three main reasons why we test. Who could benefit? Weight loss resistance. You've done it all and you're stuck. You're stalled, you're plateaued. That's step one, among other things, but that's your starting point. Gut dysfunction, we already talked about it. Brain fog, anxiety, depression. You're mentally cloudy. It's just you're forgetful. Where are my keys? Where's my phone? Where's this and that? You're not as mentally sharp as you once were. We have to look at gut. There's something called the gut brain axis. Essentially, your gut is connected to your brain. So if your gut is a mess, this is often a mess as well. So ADHD kids, again, going back to the anxiety, the depression, the brain fog, we have to look at gut. Skin problems, you might have eczema or psoriasis or acne or rashes. Oftentimes, there's a food component there. You might have chronic aches and pains, joint pain. You might have issues. Remember, whether it's bursitis, tendinitis, arthritis, plantar fasciitis, gastritis in your stomach. If you've been diagnosed with any form of itis, itis is inflammation. So we have to address the foods and we have to reduce that inflammation. Autoimmune, Do you have an autoimmune condition? Food testing is step one. Again, very underutilized, super, super important. Let's take an objective black and white look at the foods that you should not be eating. So, if you want to get tested, if you're checking the boxes with all these symptoms, and again, we'll have more symptoms below, but I just wanted to kind of map out some of the most common ones. If you want to get tested, your next step, click the button and let's set up a one on one discovery call just to make sure it makes sense. One on one discovery call, this is not a pushy, high pressure sales call. This is simply a chance to ask each other questions and determine if food testing would make sense for you. Now, understand I have a big team of practitioners that I work with, and we get the job done when it comes to testing and then objectively moving you through a path to get you healthy. So keep in mind, either myself or one of my partner practitioners will be giving you a call at the time that you choose. So, your next step, click the button, fill out your information, and then go grab a time slot that makes sense for you. So, thanks for watching, and we'll talk soon. Take care.